The law is changing. The Care Act is coming. The Department of Health are reforming adult social care.
Why are they doing this?
Well, the government wrote a white paper called Caring for Our Future. It explains how older people and people with disabilities, mental health needs and carers too should be supported and cared for by their county council. It says that people should be supported in ways they choose, a very personalised service. People should have care that meets their needs. It should be planned well and meet agreed outcomes. Support should help people stay independent. It should be preventative. The government needed a law to make their ideas become real for people who live in England. This is the Care Act. The Act replaces lots of other care laws. Many were old-fashioned or confusing, and they needed to go. Importantly, the Act tells people how their care and support should be paid for in the future. The Council already works in lots of ways that meet the requirements of the Care Act. We have carers' personal budgets. We support people to have direct payments, to plan and organise their own support. We have deferred payments, allowing people who fund their own care in residential homes to pay for it after they've died. But there's still more to do, so we have put together a team of people to make sure we get it right.
What must they make happen?
The Act says local authorities must work to ensure people's well-being is at the centre of everything they do. The Council needs to be ready to provide support or information to all sorts of local people. This is called universal support. Well-being means all people, including carers, should feel happy about the way they are supported. They should feel safe, feel that their needs are being met, and that they can make their own choices day to day. Well-being is different for different people. The Act gives carers the same rights as the people who they care for. Some people will only need advice or information. Others may need care, and if they're a carer, they may need support to care for someone else. And it's the Council's responsibility to make sure that there's lots of good quality options for people to choose from. To make this all happen, the Council and other organisations are going to have to work together. Organisations like the NHS, the police, district and borough councils, and the Department of Work and Pensions. The Care Act makes this law. The Care Act also says the Council must work with its partners to prevent, delay or reduce people and carers' needs for support. This includes better connecting people to support through their families, friends and communities. It brings in the right to an assessment for anyone, including carers who may need support. These assessments will look at people as part of their family and their community. It will assess the person's needs for care and support and look at what support they already have. They will check how much money people have to help pay for care. Who is actually able to receive care from the Council will be worked out using an eligibility criteria. Any needs a person has that have a significant impact on their well-being are eligible for support. For the first time, the level of need that triggers support will be the same across the country. People will have a legal right to a personal budget and the right to choose whether they, or their carer, wish to receive this as a direct payment. There will be more targeted support for families and younger carers. People who are not entitled to financial support from their council up to now usually sort their care out themselves. The Care Act says these people can now ask the council for help to plan or make arrangements. For people living as ordinary residents, i.e. not living in care homes, who don't have their own money but do have eligible needs, the County Council can provide them with support services. The County Council must also support carers if they have eligible needs. And the new law says that if the person moves out of their area, the local authority where they move to must carry on providing the same level of care until they complete an assessment. This should help people to move house, maybe to be closer to their family, without needing to worry about losing their care. Adult social care teams will need to work closely with services for children. They will need to make sure as children become adults, the planning is in place well in advance for a smooth transition. The teams will also support carers and parents through this process. Advocacy will be available for people at times of assessment, support planning or safeguarding when people may be at risk. Keeping people safe is going to be important. We will be checking that our Safeguarding Adults Board is organised in a way that meets the rules in the Care Act. The Council, with the help of the Care Quality Commission, will have to keep an eye on big organisations that run lots of care homes, so they can be aware early on of any changes or interruptions to services. If this happens, the local authority has a responsibility to keep everyone receiving support safe, and that one way or another their care can continue. The CARE Act is the biggest change in care law in 60 years. If you'd like to know more, visit www.gov.uk/care-act-part-1-fact sheets to see the Department of Health Online CARE Act fact sheets. Or visit our website www.surreycc.gov.uk/careact or contact careact@surreycc.gov.uk.